Hi, I'm Meredith Harris of New Life Aesthetics, and this is Lori. Lori's a guest in the office. Today we're demonstrating the Kybella treatment. Kybella is an FDA-approved treatment for the treatment of fat that's stubborn and often can't be treated with diet and proper nutrition. And so we're going to be focusing in on the area called the submental fat or the double chin. And we're also going to be treating Lori in an area that's often an age-related concern with the jowls. And the jowls are right along the jawline, an area for both men and women that tend to get heavier with age. So during this treatment, we're going to be using, again, Kybella. Kybella is a product that's been specifically formulated to take something that's naturally occurring in our body called deoxycholic acid. And deoxycholic acid is what we use in our bodies to help us metabolize fat. So when we inject this, it's a sterile product that's injected into the areas that we're trying to treat. We'll see that immediately after treatment, we start to see a swelling effect. And for the first 72 hours, swelling will increase and then gradually decrease. I always tell clients the more swelling you have, Lori, the better the outcome. So we're looking for a bullfrog effect. Don't be afraid of swelling. It's temporary, as is all other side effects. Sometimes we'll have numbness in the area under the chin or in the jowl area where we've treated. We might also feel firmness for several weeks afterwards. All of that is completely normal. It's to be expected. So I've marked Lori for her Kybella treatment, and you'll notice that there's a grid marked kind of in the areas of treatment. It's really important with Kybella that we treat very uniformly, that the injection points are tightly put together. So when we mark with the grid, it's just to help us have a guide as to where exactly we want to inject. That template, though, is very customizable. So I was able to cut it down from what we were given by Allergan to use. We've just rubbed it on the skin. Afterwards, we'll use alcohol and rub it right off, but it gives us just a marking grid for where we can inject. So if I turn her, you'll see on her left jawline that she has a few dots here. She's got them underneath the chin and then over on the right jowl also, and that just tells me exactly where I want to inject. The treatment isn't painless, but it's certainly something that she can tolerate. The injections themselves, you can't really feel the needles because we've numbed her topically with lidocaine. What she will feel is a slight burning, sometimes pins and needles, or like an ant biting type of sensation right after treatment. It goes away very quickly. It's not long-lived, and with ice applied right after treatment, it works out really well. So the ice isn't really to decrease swelling as much as it is just to make sure she's comfortable. All right, with that, I think we'll get going here, Lori. So I've drawn up all the Kybella in little tiny TB type syringes with very tiny needles. She's numb, so we're ready to go. And as I said earlier, it is a very quick injection technique just to keep her as comfortable as possible. I'll work from her right to left or your left to right. And I'm just gonna start by lifting that fat, and she'll feel a pinch here. And it will immediately swell because of the volume of fluid we're putting in. And then over the next 3 days or so, the swelling will increase before it goes down. Perfect, a little pinch here. Pinch. You may notice that I'm not going directly into those little dots because I don't want to permanently tattoo her with ink. So just go right around that marking. It's just a general guide. And over here. Again, this is just to reduce the fat right on the jawline. Perfect, last one. And I'm gonna just wipe her off real quick. We'll worry about cleaning her up later. I just wanna get ice in these areas to make her comfortable. And Lori, you can hold those in place there. So we've just finished Lori's treatment. She seems to be doing really well. She'll already have some swelling there just from the amount of fluid that we've put in today, which was several cc's of Kybella. Normal response and certainly not terribly uncomfortable. She's got ice to kind of minimize that discomfort for maybe 5 to 10 minutes after treatment. There's no need to ice going home. The swelling is welcome. We want that afterwards because it does dictate the response. So the more swelling, the better. And I think I may have mentioned earlier, we can use Kybella in any subcutaneous fat. So I look forward to having you come in for your consultation so we can discuss where we might be able to use Kybella for you.